All right, thank you very much, Mr. Martino, and good afternoon, Madam Chair, members of the board. We have again, as Mr. Martino said, a rather in-depth update for you today. First, we'd like to start off to make sure the community is aware of the update to the Governor's Executive Order 72, which went into effect as of yesterday. There are several key changes in this updated order. The first is on social gatherings, which now increases the allowable number of folks from an outdoor setting from 10 to 25. So you can now have gatherings of 25 people outdoors. Outdoor entertainment venues are allowed to have up to 1,000 persons or 30% of their capacity, whichever is lower. Dining establishments are now permitted to sell alcohol till midnight instead of 10 p.m. However, they will still be required to close between midnight and 5 a.m. And as of May 1st, overnight summer camps will also be allowed to open with stringent mitigation measures in place. So our current 7-day moving average of our percent positivity is 8.4% as of February 26th, the last date that the data is fully complete, that the measure has been calculated. This is the first time since November 8th where our rate has been below 8.5%. So we are seeing a steady decline, and that's encouraging to see. However, we still have quite a ways to go, and it's important that we maintain those mitigation measures of hand washing, social distancing, mask wearing, and trying to limit our contact with others until conditions continue to improve. There's some additional data dashboards now that are available that drills down in a bit more detail, both on testing and vaccination data, so we're going to show several of those in depth today. One of those dashboards shows that we've had, in the last 24 hours, 74 new cases reported. The 7-day moving average is 91 new cases, or expressed as a per capita per 100,000 population is 19.5 cases. Hospitalizations continue to decline in Northern Virginia, and they continue to have that excess capacity of up to 120% inside their existing walls if we should see a spike for some reason that would require more folks being hospitalized. But fortunately, those numbers continue to decline. And with our data here in the health district, in the last 24 hours, 1 new COVID-related hospitalization was reported with a 7-day average of 3 hospitalizations. Fatalities also continue to decline throughout the Northern Virginia area. I will share just briefly that deaths are typically a lagging indicator because there's a delay in reporting, so that the deaths that are being reported now occur primarily in January and February. And this is attributed to the increase that we saw over the holiday season and that delay in reporting. So the local data in the health district does show an increase in fatalities over the last number of days. However, again, as it is a lagging indicator, this data is somewhat delayed in reporting as cases are assessed and attributed to whether it was a fatality related to COVID. So in the last 24 hours, there were 4 new cases reported, and that these are based on report date, not the actual date of death on the death certificate. So it's as of the report being reviewed and received, and the 7-day average is 9 deaths. Our testing efforts continue. So in terms of our testing update, we continue to offer the same 200 tests per day. We are still seeing a decrease in demand. An average of about 40 people a day are taking advantage of the testing opportunities. We have increased the amount that we're advertising those opportunities. So every update that our Joint Information System process puts out regarding our overall response is inclusive of both our testing sites as well as our vaccination efforts. So we are still working to get the word out, but we are still seeing that decreased interest in testing. The Commonwealth and the Health District continue to be in Phase 1B of vaccine distribution. Of note, VDH did add 2 groups to 1B since our last update. Clergy and faith leaders were added as Group 10 of 1B, and cleaning and janitorial staff were added as Group 11 of 1B. So they are now officially reflected as members of a phase in the Commonwealth strategy. So now we're going to go through the vaccine dashboard. The one quick note to share is that previously the federal long-term care facility doses were being shown as part of the percentage of first and second doses, but now that percentage number is just of the Commonwealth's program. So the cumulative total vaccine doses that's about to be shown on the next slide comprises both the federal program as well as the state's vaccination data, but this percentage is just the Commonwealth's first and second dose percentage. So the federal long-term care program does reflect a slight increase in number of doses administered based on those that have been received, and we understand that that is because several health districts have made some reallocations to solve gaps that may have occurred throughout the state as those facilities were being vaccinated. The number of first doses received versus administered is also continuing to increase. And then the number of second doses is only about 400,000 behind the first doses, so that just reflects that we continue to see second dose shipments 3 to 4 weeks after the first doses have been administered. So statewide, it should also be noted that local health departments and hospitals are still redistributing to other community health partners, pharmacies, and medical practices, which is why those providers have administered more doses than they've received, again, because they have received reallocations from local health districts and hospital systems. And that also applies to second doses. So now we're going to spend a little bit more time with the enhanced data that's been made available at the health district and locality level. I'll note that for these next two slides, it is based on the locality of residence of where someone is physically located and how their dose has been counted. So for those who are residing in the health district has fully administered 73,878 folks, of which 23,673 have received both doses, so they're fully vaccinated. And again, that's based on the locality of residence. That's the overall count, and then the measure is also now shown at a rate per 100,000. So at that rate, those who reside in the district have received 10,674 of at least one dose, and then 5,033 of both doses at a rate per 100,000 residents in the district. As of Sunday, the Commonwealth has also made race and ethnicity data available, and then additional data by age group and by sex. So we are now able to share that data with the board. And it is also expressed based on an overall count and then broken down by population of 100,000. So the previous slide was age and sex, and now race and ethnicity data. I will note that there are 16,843 vaccinations where race and ethnicity data was not reported through the state system.
So Brian, can you go back a couple of slides? I want to make sure folks are seeing the data on a percentage basis. A greater number of those 65 and older are getting the dosage. That would be the slide on the right as a percentage of that population group. On the left, you see the raw number by age group, which reflects the folks who are in, we believe, the way we read it, category 1A and 1B, 1 and 2 would include nurses, first responders, healthcare workers, and the like.
All right, and then moving on to our continued planning efforts for vaccine distribution. The Manassas Mall site continues to operate, and starting on Wednesday, we'll begin using a new site on the east end of the county. This is the former Gander Mountain store on Worth Avenue. It will be used initially by Walmart as part of a special federal allocation this week, and then will begin to be used by the health district for clinical capacity beginning next week. This is a very large site that will have capacity for over 100 stations as vaccine is available to be used at the site. It is important to note that for both these clinic locations, appointments are coming off of the wait list, either being managed at the state level for the Walmart pilot or by our local call center here for those doses that are being scheduled within the health district. So the vaccine inventory continues to increase. The Pfizer allocation this week is 7,020 doses, which includes both first and second doses. All of those have been redistributed to Novant and Kaiser, either to work off of the wait list or out of their membership pool of folks who are eligible and age 65 or older. And I will note that the school staff have been completed from all of the initial first doses as of last week's clinic. They are still, however, administering second doses, and that process will continue for the next, I believe, at least 2 weeks. As of Saturday the 27th, for Moderna, the district had received 31,250 doses, of which 24,431 had been transferred to partners or administered by the health district, which left an on-hand inventory beginning this week of 6,819 first and second doses. The district is expecting to receive 7,300 first and second doses, of which 5,200 will be transferred to partners, and of which 4,752 are planned or scheduled to be administered at health district clinics, leaving a remaining dose inventory of 4,167 to start off next week. Vaccination clinics that are occurring this week as of the 1st. The health district's clinics will be operating at Manassas Mall for second doses, at Beacon Hall for first doses, and then starting Saturday only at Gander Mountain for a second dose clinic to address a large number of second doses that are coming due. We're continuing the partnership with Safeway at Veterans Park. Walmart, again, will be operating at that new Gander Mountain site beginning Wednesday for 600 doses a day from the federal allocation, directly from the state portion of the health district waitlist data. And then on Saturday, the partnership with Novant and Prince William County Schools will administer about 1,400 first doses at Kelly Leadership Center from the health district waitlist. Separate from the allocations that the health district determines how they are shared, the federal partnership with our pharmacy partners continues to add more sites in the community. We continue to have CVS in Gainesville. However, Safeway is adding 3 sites. The Independent Manassas Pharmacy has been added as a partner, as well as 3 Giant stores. So they are, for the most part, working off of the state wait list. CVS is still through their process, but our understanding from the state partners is that they are using the state call center with the wait list data that's been provided by the district to book these folks in for their first appointments. So the state call center continues to operate. The previous VDH number directs to it. However, a new number is available. It's 877-VAX-IN-VA is that direct line into the wait list and scheduling component of the state call center. Again, as I mentioned, they are just piloting with some of those pharmacy partners, booking off of state wait list data into those slots. The local call center continues to operate, primarily getting folks scheduled for their second doses when they're within 7 days of being due for their second dose appointment. However, they are assisting in booking first dose appointments for health district clinics, as well as Safeway, Novant, and for some for Kaiser until the prep mod process is live and online. For the wait list, again, that local wait list has been closed since the 12th. There have been a total of 10,643 people scheduled off of the health district's wait list data, which is an increase of 8,474 since our last update to you on February 15th. So we do continue to make headway in getting people scheduled off the wait list data as this new state call center and wait list process comes online. So now we want to spend some time updating you on the work of our task forces. For the Economic Recovery Task Force, there are 3 specific areas to focus our attention on, 3 programs that are in effect through June 30th. The first is the IGNITE program, which is a growth to selected high-growth companies and tech catalyst organizations. The second is the Fire Up program, which is a business coaching and mentoring program. And the third is our ongoing effort to offer rebates for construction permits for modifications that people are making to their facilities to either increase capacity or comply with COVID standards. So all 3 of those programs will continue to be in place through June 30th. On our cost recovery task force front, we are still coordinating internal to our EOC process, both with expenditure of CARES Act funds, as well as identification of funds that may be reimbursable under the FEMA Public Assistance Program, and that will be ongoing for the duration of the pandemic until either the CARES Act funds are entirely expended or until the eligibility period for the FEMA PA reimbursements closes. Our community testing task force has administered more than 22,747 tests to date since July 13th when the task force began operating. And the community feeding task force last month alone redistributed 1.4 million pounds of food in the month of February. There continue to be some programs available to help folks out with their utilities and rent and mortgage. There are two specific programs. Virginia's program provides assistance for rent payments that were due beginning April 1st and ongoing. Renters and landlords are eligible to apply. And for more information, the link has been blued out, but we will make sure it is available in the online presentation. Apologize for that. The county's Office of Housing program continues to provide 6 months of mortgage and utility assistance as well. To date, the office has assisted 348 families, and the link for more information is pwcgov.org/government/department/housing. I'll also note that the federal moratorium on evictions has been extended through March 31st. Our expanded outreach campaign to encourage folks to get vaccinated when it's their turn launched as of yesterday, so we're very excited to have this campaign out in the community. There'll be a variety of radio ads, bus ads, and other paid placements to make sure that we're getting the word out to the community that it's still really important to follow our mitigation measures of wearing a mask, washing your hands, social distancing, and getting the vaccine when it's your turn so that we can all continue to reduce the curve and get COVID behind us. And finally, there'll be a virtual town hall coming up on Thursday with Dr. Anscher, our health director, and Dr. Fabian Sandoval from the Emerson Clinical Research Institute. That will occur on March 4th from 6 to 7 p.m. If anyone in the community has questions they'd like answered during the town hall, they can submit those before the end of the day today to eocjic@pwcgov.org. And with that, we'd be happy to answer any questions you may have.
Thank you very much, Mr. Meisner. I will start with Supervisor Franklin.
Sure. Just have several questions. The demographic data, first of all, thank you all for working to get that information. Several of us have been asking for that. Obviously, there's a lag, at least according to the numbers we have here, between Black and brown communities. Do we have information on the number of demographic data on those who are registered to be vaccinated?
So the waitlist data is still up at the state level, and of the data that we passed from the health district up to the state level, it was not complete. So this data that's being reflected is based on the race or ethnicity that is reported at the time of vaccination.
Okay, it'll be good to see how many of those in those groups are actually registered to figure out, you know, A, kind of what the problem is in terms of the lag, and then B, I'm curious, obviously I issued a directive to have the equity working group to come up with a plan to help better get vaccinations to these communities. I understand part of the challenge is that the state is running this process. And so, you know, even if we were to come up with the plan within our communities to say, hey, we'll work with the churches to do A, B, and C, we have this registration list that the state is solely managing. And so I'm curious, Mr. Martino, if you have any updates with regards to the directive and if that means that we need to be working directly with the state to come up with a plan to better vaccinate Black and brown communities.
Thank you, Madam Chair, members of the board. So a couple of things on that. First of all, we are drafting that. We've drafted that letter that you requested we send to get more access to the demographic data. Also, Dr. Anscher has been doing some reaching out to, through the partners, to certain areas of the county, and I think Dr. Anscher can speak to that. But it's my understanding also that we have just with Sunday gotten access to the state database to begin to understand who is on the wait list and where they are by geography and various other sorts. And so we only just got access to that, so we'll begin to see what we can do to address the most at-risk, the most vulnerable in the community.
Mm-hmm.
Madam Chair, members of the board, I'm Dr. Anscher. I'm the health director for the Prince William Health District. Number one, we've specifically chosen partners to share a vaccine with that address those that have equity issues, such as the Community Health Center. There are 3 sites. The free clinic, we ensured that they were vaccinated, and as well as we've The Northern Virginia Health Directors met with the North Star Network, which is a network of about 175 churches, and we're providing them education so that their pastors can present the vaccine information, be a trusted, face of information. We're also going to they have a meeting on Wednesdays, and we're going to talk to their pastors and answer any questions they have about the COVID vaccine. Additionally, we had met with Dr. Underwood from the state, as well as Sable K. Nelson, about equity issues and how to address it. On Friday, we have a meeting with Hispanic Latino influencers in the community to understand a little bit more about the hesitancy and what we need to do in order to address that issue.
Yeah, and the reality is, we can't encourage certain communities to sign up and then not actually vaccinate them. And so that's part of the challenge. I know we need more vaccinations, and I do understand that. But while we're also encouraging them to sign up, we need a plan to actually vaccinate them once they do.
And that's part of the meeting to decide on Friday, to decide what to do. But I don't think you can just open up a clinic without doing some footwork. If they're hesitant, you have to, before you actually open up a clinic, you really have to do some work to encourage them to understand that it is safe.
Sure. I understand that.
Yeah.
And I think many of my residents understand that. But for those that do want to get vaccinated, that are on the waiting list, and then they see these numbers, I'm speaking to those that are on the registration list to actually be vaccinated. We need a plan to close this gap that we're looking at here. The hesitation discussion is a different discussion. And I do believe we're doing the work there, but we need to do a better job of closing that gap. Just a few more questions very quickly. Page 21, it mentions Safeway at Veterans Memorial Park. Does that mean that that Safeway will be operating out of Veterans Park?
They
Okay.
have an actual pod, and it allows them to vaccinate a greater number than if it was in a store.
Sure. And then same situation at Gander Mountain. Walmart will be doing those vaccinations?
Except for it's just a 3 to 4 day event. This is the way it's been set up by the federal government. They come in 3 to 4 days, they vaccinate, they go vaccinate someplace else in the state, and then they come back and do the second doses.
Sure. And then do we have the rate of vaccinations in Prince William County versus other counties? I think the board received a couple of, that was probably in there, the board received a couple of emails about why are we at the bottom. Now, I did my own research, and it looks like, Fairfax and Loudoun, they do have more vaccinated individuals, but not that much more. And it seemed like some of the rural areas actually were at kind of the topper level of the food chain. And so, but it looks like that's in this information.
Yes, it is.
Okay. And then very quickly, we also got a call, at least into my office, about an individual. She's about 70 years old. Her entire family signed up, but her 20-year-old was actually able to get vaccinated. And I asked her, is she in a school system? Is she a healthcare worker? Is she part of this 1A group? And the answer was no. And so do we know how the state is going through the registration list?
I don't think it has to do with that. There was a issue with PrepMod. Now, we're not using it yet. And
if you can step to the mic.
I'm sorry. And I believe it's been corrected. There was an issue. One of our partners uses PrepMod. One of the hospital partners uses PrepMod to schedule. And unfortunately, anybody, if they shared a link, other people signed up that should not have signed up, and that's what happened.
And that issue is rectified?
What we did was they stopped using their system, and the county call center, the Prince William Health District call center that the county is manning, started scheduling them, calling people and scheduling them so that we wouldn't use that system. My understanding, it's been rectified, but it's being tested, and also the hospital that was using it is in the process of testing to make sure a fix has been done.
And then lastly, the town hall, I know it's Zoom. Will it also be live streamed and recorded? Those are the questions I got.
It will be recorded, I believe, live as well, until the capacity is reached.
Okay.
What is the
Yeah.
capacity?
Can you repeat that into the microphone just because,
Sure, it will be recorded and also live until the capacity of participants has been reached. I believe it's a 10,000 person capacity, then it'll also be recorded.
Okay, great. Thank you.
if you get 10,000, that's great. Okay, I saw Supervisor Angry, then Supervisor Canlin, then Supervisor Bailey.
Thank you.
Thank you, Madam Chair. First of all, Mr. Misner, hey, thank you for adding the tracking the COVID-19 data currently as it's going on. I think that's still important that we know hospitalizations, death, and all that good news. Now, just a couple of quick questions, kind of to lead with Supervisor Franklin, and it may be for you, Dr. Asher. One of the things that that we can do, I'm seeing here, is as we're now starting to, I say infiltrate, these communities of color that need vaccination, the key thing is communications. So my thing on the slides that you just showed is, has and I'm pretty sure there is, communications involved in getting this out that we can share with our districts to get it out as well. And the reason I say that is because I get a lot of calls from constituents, as we all do, asking about this process. So one of the things I tell them, like I knew that Gander Mountain was a deal because you guys sent us an email, but said, don't say anything. So I told them to tune in tonight to watch this so they can know what's really going on, so they can pay attention to that. Because I think a key thing here is really communicating and getting it out. And we can say it's their responsibility to find this information, but I think we play a key role in assisting with that. So to the question of the communications, is this package to go out countywide, the information you shared?
Yes, Mr. Angry, members of the board. So Communications is participating in producing the materials, and we're going to be getting that out, and that's part of how the whole, the JIC is working, the Joint Information Center operations, because the cities are involved and the health district and some of our partners. The item about the Gander Mountain, we were negotiating, and we hadn't signed the lease yet, so we didn't want to get in front of ourselves too far ahead. We have executed that lease for that space, and that'll be available to us for the duration, but we'll be beginning to ramp up the whole campaign and more about our sites as we go forward.
And I just want you to know, because I'm a soldier, I follow orders, and the order said don't leak that, and I did not, just so you know. So I was happy about it to hear it, and I wanted people to hear that tonight, and I think the announcement said that you would be presenting that tonight at the board meeting, so that's actually good. And then the last thing I have, because we have all these sites now coming into play and everything, is this a result also of Johnson & Johnson being approved, and will that be the vaccine that's coming in? And then a real question with Johnson & Johnson is, and I want to just speak specifically to the African American communities, many have concerns about, of course, the Johnson & Johnson vaccine. And so if that's coming in, I think we're going to have to really tighten the parameters on getting that information out, that people know it's safe to take. So is that a result of, is Johnson & Johnson going to be?
I'll let Dr. Ansher speak to the Johnson & Johnson vaccine, but I'll just reiterate that we continue to try to plan about 50% in advance to make sure that facility space is available and that the staffing is ready so that if additional vaccine candidates and doses are received, that we can accommodate those. But I'll let Dr. Ansher speak to Johnson & Johnson.
Okay.
The Johnson & Johnson, the state got 69,000 doses of Johnson & Johnson, and we were instructed to use it for mass events so that not a particular community would feel targeted. And so when we advertise Monday, we're going to have a mass event with it. When we advertise, it'll be clear if they sign up for that event, it's a Johnson & Johnson vaccine.
Okay, I have a fear that if folks don't want to take that and they'll have these concerns that, well, maybe it's the Moderna I should be taking, and so they miss that opportunity. I don't know how we can craft that to shape that to make sure that they understand this Johnson & Johnson is just as good as the rest, and so we don't have these folks, pushing and delaying down the road to try to get to one that they think is the best one out there. So
I think the information in press releases that the communications people have been doing daily includes that information. They will not lose their place on the wait list if they choose not to take it. It will be just clear that that's what's being offered so that when people sign up, they understand that's what's being offered.
Yes, I think that's important, so thank you there. And then just really one last question, I think Mr. Misner probably had to answer this one. You talked about like the data we get in of where the vaccination, the totals we get for the county. And I think you said there was some data that we can't get from like maybe some hospitals or clinics. And I'm asking because my daughter works for a pediatrics clinic, and of course they called her in and they gave her her vaccination. And I'm wondering in the data, is she added in that data? And if, you know, there are locations around here that aren't sharing that data of their employees that they're vaccinating per the medical 1A, 1B, is that an issue, or is that something, are we getting that data? Are we not getting that data to add to the total? I think that'll definitely help when you look at the disparity gaps between, you know, black and brown, and
Sure.
it's not just in the community. They can have great jobs and get them vaccinated through their job, but we're just not seeing that data.
So for data, sir, are you asking of people who are registered or interested in taking versus have actually received?
Have actually received.
So my understanding is that anyone who signs up to administer a vaccine has an obligation to report that administration within 24 hours to the state system.
Okay, thank you, thank you.
So we're going to go to Supervisor Cannon, then Supervisor Bailey, Supervisor Vega. I overlooked who had her light on before, and then Supervisor Bodie. Just
Thank you, Madam Chair. I'll try to, I've got a few questions here, but I'll try to be concise in my questions. I wasn't very concise in my intro and my questions, but anyway, okay, now I'm behind. If we could talk a little bit about the numbers that we're seeing of folks after they receive the vaccine. So I think one of the numbers that I've just been reading out there is the rates of people being hospitalized or dying of COVID after receiving the vaccine is almost zero. And I think if we can talk a little bit about that, because I think when we talk about Moderna, we talk about Pfizer, we talk about Johnson & Johnson, and all these different percentages of how effective they are, the real number is how many people die of COVID, or the lack of people dying from COVID or being hospitalized with COVID after they receive the vaccine. If you could just talk about that. I mean, this is almost to the point of a miracle that you have this vaccine that people can receive, and it almost ensures them, at least the numbers that we're seeing so far, that they're not going to go to the hospital or die of COVID. Can you talk a little bit about that?
Are you talking about Johnson & Johnson or Moderna?
I'm talking about all of them.
Okay.
I'm talking the things that I have been reading that show whether it's Moderna, Pfizer, or even Johnson & Johnson, that the hospitalization rates and death rates of people who have been vaccinated is statistically very low.
And actually, our hospitalization rates have gone down dramatically in Northern Virginia, as well as there are beds occupied, but they're not being occupied by people with COVID-19.
Or people who have been vaccinated.
That I can't tell you.
Well,
from the data I
maybe
get.
that's the request that I'm making, is if we can start tracking, or if there's any way to track that number. Because I think that's the good news that gets lost in some of this outreach when we talk about some of these other things, or where we try to convince folks that these are important vaccines to have, that the folks who have been vaccinated are seeing a very low rate of hospitalization of COVID or actually dying of COVID.
In the research, the studies going up to having the vaccines approved, all three, the main positive thing, we don't know completely if it decreases transmission. We do believe the Johnson & Johnson lessens the possibility of transmission of the virus. But all of them have decreased severe disease as well as death and hospitalization. But in particular, that Johnson & Johnson, even though you're comparing apples to oranges because the way their efficacy was determined is different. First of all, Johnson & Johnson's studies were done during the variants being present. So you would expect that potentially it might not have the same efficacy. But it's still pretty darn good. We have flu vaccines that we use that are 50% or less each year because it's hard to predict exactly what virus will be out. And these Johnson & Johnson is 85%. And of course, we know Moderna and Pfizer are 95%.
Do we know if the state is, or the health district is tracking hospitalization rates or death rates for those folks who have been vaccinated?
I
Dr.
don't-
Ansher, can you make sure you speak into the microphone?
I'm
I'm sorry, I know
sorry.
that they're having trouble. And so
I'm
maybe you
sorry.
could lower the podium for Dr. Ansher since it's so
I can.
tall, that might help. If you could do that, Brian?
We can just slide this forward a little bit.
Yeah, thank you so much. Thank you.
Sorry. I don't know. I can certainly check.
Okay.
If that's a number. I would assume, because that's probably part of the follow-up of people getting vaccinated, but I can check.
Okay, that'd be great, because I think that would be an important number. Again, I think that could be part of our good news story that we tell people, is that if you can get vaccinated, your chance of getting sick from COVID, going to the hospital, or dying from it is almost zero, or whatever that percentage is. So I look forward to seeing more information on that. I guess, Mr. Meisner, in the presentation, it talks about doses given, about 74,000 from the Prince William Health District. Do we know how many doses have been received? Or is that the same number?
Was this the slide, sir, or was it a different?
No,
place?
it was earlier. Right, next one. There we
Yeah,
go.
so
It says
that
doses
is-
administered, about 74,000, but it doesn't talk about how many doses have been received by the health district.
So this particular data set from the state is based on the locality of residence of someone was administered a dose and then they resided in this district. The data for what has been physically received by the local health department, vice the other providers, is not in these dashboards, and there was the difference of how that was allocated prior to the week of January 25th, and then the health district having a decision beyond that point. So the data from what the health district is tracking locally and reporting to us is this vaccine inventory slide of what they have control over.
So I know it's been 2 weeks since I've been here at the board meeting, but last time I asked two specific questions. How many vaccines doses have the health district received, and how many they've given? Can you give me those two numbers?
So that would be the data in terms of, for Moderna, 31,250 have been received. 24,431 have either been administered or transferred to a partner, is the data that's being reported to us. Dr. Ansher, do you want to expand?
We don't just keep the
You need to
doses
speak into the
for-
microphone,
I'm
Dr.
sorry.
Ansher, I am so sorry.
That's okay. We don't just keep the vaccine to ourselves. First of all, we still have not received our ultra-cold freezer, so we cannot manage Pfizer, but we have partners that can manage Pfizer. So we share those vaccines with those partners. Number one, Novant Hospital, UVA Hospital, and also Kaiser is vaccinating people in our community as well as off our wait list.
Okay, if it's in this report, I apologize, but I'm feeling frustrated, and maybe I'm just not understanding, maybe I'm just not seeing this report. I think it's a pretty clear question. How many vaccines, how many doses has the Prince William Health District received? Whether it goes out to somebody else, or I'll even take how many doses has the Prince William Health District received to administer? Is that the same number of how many? I'm having a hard time understanding why this is such a difficult question.
I would have to come back because this is of the last 2 weeks. I don't have with me the total numbers that we have received and distributed. I'll be happy to.
Is that a number that's available?
It is
Then I guess with all due respect, how come I was ignored 2 weeks ago?
I wasn't here 2 weeks ago.
Well, I would present that to county staff, that those were the two questions that I said I'm going to be asking every single time that we have this presentation. How many doses have we received, and how many doses have been given out? And from what I'm hearing now, we have those numbers. You all have those numbers, but for some reason are not giving it to the Board of County Supervisors. I request one more time to please provide this Board of County Supervisors with the information of how many vaccine doses have been received by the health district, and then how many have been given out.
Are you, this is for the last 2 weeks, are you asking total? I just need to be clear.
I'll take anything at this point.
Supervisor Cannon,
this
I
is-
was wondering, because the information isn't great at the beginning. If you got it over the last 2 weeks for like a running total, that would at least be better than nothing, right?
I would take anything at this
Okay.
point, because right now I've been ignored. And frankly, this Board of County Supervisors has been ignored, because we all agreed with each other that was information that we felt was important to share. So on behalf of the Board of County Supervisors, I demand that we get this information for our next presentation.
This is the last 2 weeks of vaccines. You did mention that you would be glad to have something.
Okay, so how many vaccines have we received as a health district in the last 2 weeks? And then how many over the last 2 weeks have we given out?
7,020 doses, first and second doses we received. What happened is we have a lot because.
I'm sorry, I don't need the explanations. If you just give me the raw numbers here.
But you have to understand why it's that's 2 weeks. Typically, we get it weekly. The reason it's 2 weeks was you have to understand.
Well, I don't need to understand. I just need to get an answer to my question, which I've respectfully asked the last couple weeks, and it really feels at this point that the information is being withheld to us. So I don't want to put you on the spot to add the numbers here and to give us, if you can provide the Board of County Supervisors sometime later today the numbers, then we can move forward.
Why don't we do that? That would be a better way to move forward. And we still have a lot of other questions. If you.
Madam Chair, I just have one.
No. I'm just saying. I'm talking about Supervisor Lawson interjecting at this point.
Well, actually, I'm just trying to help him out. It was actually we've repeatedly asked.
That's what I meant. The
I'm
board
talking about
is
something
reviewing.
adding value.
Yes.
Okay.
Real quick, and I know Supervisor Franklin that was the wrong word, but she pointed this out and very appropriately pointed this out, and I'm going to harp on it. Let's put it that way. Going to 18, slide 18. Now, if this race and ethnicity breakdown is based on just the number of folks who happen to be in those districts in Prince William County, well, then I guess that's an understandable reason why there is such disparity here. And that should be explained, because after all this board has talked about, and Supervisor Angry was very kind, I think, when he talked about, well, let's start reaching out. Frankly, there should be no let's start reaching out, because Supervisor Franklin, Supervisor Bailey, Supervisor Vega, every single person on this board talked about the apprehension from various communities months ago. And outreach with influencers should have happened months ago, because we all knew that was coming. We knew that there was apprehension amongst these various communities for whatever reason. So I'm glad that at least it's being addressed right now. There needs to be a lot more done, because again, unless this just happens to be the number of folks who are first responders and teachers, and this is the ethnic breakdown, racial and ethnic breakdown, this is unacceptable. And I'm glad, and I'm not going after you all, I'm glad we now have this information to develop some sort of plan, because in a majority-minority community, you add up all of those other minority communities, and it's still not above what the white community, and I haven't received it, so I'm not part of that number, but that's unacceptable. And there needs to be some plan. If we're seeing this number a month from now and there's still that disparity, then people need to start getting fired. Thank you, Madam Chair.
We'll go on to Supervisor Bailey, then Supervisor Vega, and then Supervisor Bodie. I will give us a time check at 5:30. We still have a bunch of stuff to go on for the rest of the evening before the evening session. Supervisor Bailey.
Okay, Madam Chair, thank you very much. First things first, if you could, Dr. Answer, explain to me who is North Star. You mentioned that the North Star organization was
Network.
bringing the churches together.
They're a network. They actually reached out to me. They're a network. It's mostly Baptist churches that meet and, I guess, share information and whatnot. So it's a network of mostly Baptist churches.
In this
and-
area,
In in Northern Virginia.
Northern Virginia? Okay. All right, so let me just, I'm sorry, I didn't mean to cut you off. So Dr. Ansher, let me just say this, and I'm going to be very pointed with this. I can appreciate that organization and the information that they could provide to you, but I feel like we could provide that information to you faster and get you to where you need to be in terms of serving our community. And I say that from a standpoint of, I know for a fact that my church, which is one of the largest churches in Prince William County, is waiting to hear from you and your organization to administer the vaccines. So I'm trying to say that maybe we can offer you that information a lot faster and a lot more pointed than you can get from a Northern Virginia, organization in terms of the vaccines when Johnson & Johnson comes through the pike. Just want to offer that to you in terms of vulnerable populations, okay? And then secondly, I'm a little concerned and frustrated in that I feel like on the northeast and the southeast portion of the county, and maybe even the southeast, I'm just going to say southeast, because I see northeast is being taken care of. My community is always forgotten. And it happened with the COVID testing, and now it's happening with the administration of the vaccines. And so I'm concerned, I'm very concerned when we talk about vulnerable populations, Black and brown people, but also older people. That's where I'm getting the phone calls, because I've got a lot of senior citizens in my community that need to be served. And I can't just entertain them by hearing them. I've got to bring forth action and partnering with you and your organization. And so collectively, I just want to say, I think that we can provide some opportunity in administering as Johnson & Johnson comes down the pike, and administering the vaccines if you just talk to us and ask our opinion about certain areas and serving, and those numbers will change. Guarantee. It happened when we were doing the COVID testing. Trust us, we can help you with this. And then lastly, Brian, if you could just, no, I have another question. Are there any other secrets that we can look for coming down the pike next week in terms of locations? Because I need to know that in terms of servicing my community. My colleague to the left of me kept a secret, and he's really good. Sergeant Major is really good at that. And I can keep a secret too, but I need to have vaccines in my community, and I'm demanding that.
We have directed the federal pharmacies such as CVS and whatnot, to have sites in your community, but I can't control. We have specifically, even Mr. Connolly's office has written to support that to the state and to the federal government. We are specifically looking at sites in your community to have pharmacies, and there's the potential also, I guess, for a site there. But
I need to know that. I mean,
we don't know it in advance until,
Okay.
to be quite frank, because it's a federal program. We don't know it in advance. We can make recommendations, but we don't necessarily know it in advance until it happens.
So Dr. Ansher, I understand that. And if there's some sites in my district specifically that you're looking at, I want to know that. I want to know that as soon as possible. And I can keep a secret, but I have to be prepared to serve my community. And going back to something that Supervisor Canlin just said, when people are dying, secrets are not a part of the game. And people are dying, and we want to prevent them from dying. And so we don't have to recreate the wheel like we did with testing and keep things so close to the vest. You can trust us. I promise you, you can trust us. And then lastly, I want to have people to participate in your upcoming town hall. So, Brian, if you can administer that flyer back to us, please, that would be helpful. Thank you, Dr. Ansher.
Sure.
Thank you, Supervisor Bailey. Supervisor Vega, then Supervisor Bodie.
Thank you, Madam Chair. Brian, on slide 20, we see that there's 4,167 remaining doses of the vaccine. What was the reason why these didn't get dispersed?
As I tried.
Please wait to speak into the microphone.
Sorry.
It's for, because
What happened is originally we would have had 800 doses left, but because of the weather, there was a week where we did not get vaccine, so the following week we got twice as much vaccine. And that's.
Okay, thank you. How many weekly doses are we receiving of the 161,000 now being allocated to the Commonwealth per week?
It changes. To be honest, we go week to week to find out what we receive. This week, we're receiving, last week, I won't know till this evening for this week. Last week, we received 4,100 of Moderna and 3 trays, 1,170 times 3 trays of Pfizer vaccine. There was no Johnson & Johnson at that time.
Okay, and then just wanted to share, we all have our stories to share in terms of emails that we receive from our constituents. One gentleman in particular was really upset because he hadn't heard anything in regards to his appointment or even a rough idea of where he was going to get his second dose. After the merger into the state system, we were told or under the impression that folks would, get some type of message to indicate where they are on the wait list. Do we know if this is happening?
I don't believe that was. They are not. I don't believe they're able to tell you where you are in the wait list. I believe they can tell you you've been registered.
So there are no periodic messages being sent to folks letting them know.
They'll let them know that they're still registered, that they are registered.
Mr. Meiser, do you have anything to add to the state system at all?
I couldn't speak for the state system, but just based on the data that we transferred up, people should have received an acknowledgement. And then our understanding was that at some point, notifications would begin, but we would need to work with Dr. Ancher and check back with VDH to confirm what's supposed to be happening moving forward.
Okay, thank you. And then I'm pretty sure my colleagues up here can agree with me that the data set of information that we received was very comprehensive and it was great. I'd like to know if we could get this on a more regular basis.
Let us check on the frequency of the data being updated on the state systems that we can pull for you, and we'll get back to you with an interval that we'd be able to support.
Okay. And then during the presentation as well, I saw that the numbers, you listed the numbers, the total numbers that were transferred to the state master list. I keep going back to this because of the frustration that people are experiencing in terms of the number that they were given that had nothing to do with their place in line, which was the impression that they were under. Is there any way that we as a county can use that master list to create a list to give people some sort of indication of where they are in terms of getting the vaccine?
So we certainly understand the frustration. The difficult position that we're in is that we were told to turn off the local list and pass the data up to the state. And now that the state is beginning to make that data available for the federal pharmacy partners to start booking off of, and then I believe eventually to the health district to start booking off of, if we were to give a spot in line based on that point in time on the 12th of February, that will be different than what's reflected in the state system, because the state system is automatically marking someone as served if there's a record of them being vaccinated by CVS, for example, or by someone who went to the doctor's office. So the spot in line that we passed up to the state truly was only that spot in line between the point of time of Friday afternoon on the 12th and Monday when they turn their list on, or Tuesday when they turn their list on, and they're daily now checking against VIIS and marking people off the list if they've been vaccinated. So it'd be very difficult for us to take that local data and have that match up with what the state, we hope, is going to begin communicating very soon. But we understand the frustration, and we'll keep working with Dr. Ancher and VDH to try to get a more concrete answer as to when that information is going to be shared.
So is there not a way to reconfigure what we have based on timestamp?
We have the timestamp data, and we continue to work within the priority groups that Dr. Ancher is giving us based on timestamp data. But because people are now being booked by the state call center for federal pharmacy program appointments, And we understand hopefully some point this week or next week, the health district will also be giving our local call center that data to be calling off of instead of using the version that existed in time on February 12th. It's very challenging to say that it's actually accurate based on how it currently sits in that state system.
I understand that it won't be perfect, but at the very least, I would continue to encourage you all to look at it and, give us something to work with so that we can alleviate some of the frustrations and concerns that our constituents are experiencing. Also, how many people have signed up for the vaccine from phase 1B that still need to be vaccinated in Prince William County?
We would have to check the data and get back to you. And again, it would be based on the snapshot in time when the local wait list closed on the 12th. And then we'd have to see if there's any visibility into what the health district's data in the state wait list says about 1B.
Okay, and you're probably going to have to get back to me as well, but could the board get a breakdown on the number of vaccines administered to each priority group, professions in phases 1A and 1B?
Do we know if that exists in VIS?
I think we might be, excuse me. I believe we might be able to do that as to how many people were vaccinated, and yes.
Okay, along with the total number plus percentage of each who have registered as well.
I'm not sure that I can do that. That I'd have to look at the dashboard, but I know that we can determine the number that have been vaccinated.
Okay, thank you. And then just to wrap it up, last week I saw that the Prince William Health Department is sending inspectors if somebody files a complaint on a small business for somebody not wearing a mask or what have you. Is there any way that we can also perhaps train these inspectors to help us out at the call centers to improve our poor vaccination rates instead of citing people and trying to shut down small businesses?
I think they use education. They don't have the legal authority to shut it down. We always use education first, and that's all that's needed.
Okay, so when we have small businesses contacting our office, you say that they educate first, and if somebody else continues to call in and file a complaint, what's the next step?
Generally, we don't try not to close places down. We educate, and sometimes there's not truth, and that's why they come out to evaluate themselves what's going on. But there is executive laws that we're supposed to follow, and unfortunately, environmental health from the health district was put in charge of ensuring that those laws are followed.
Thank you.
Supervisor Bodie.
Yeah, Madam Chair, thank you,
sorry.
Madam Chair. I'll be very brief. First, thank you for the meeting that you had with my office a few days ago. I think it was really productive for both sides. And just to highlight a little bit what we talked about in that conversation, obviously, as was said by one of my colleagues earlier, we are doing education, but I think that another piece of this is acknowledging that inequity that was put up on that slide, right? And that's doing something to proactively address that inequity, because as was said before, we are a minority-majority community, and right now the numbers in the vaccinations, the proportions of that and the ratios do not reflect that being an equitable situation. So I hope that our dialogue with your office helps address that specific part, because we can educate people, but unless our vaccinations and our hitting people where they are and getting them safe and secure, unless that's a key component of this strategy, people are still going to say, hey, this is obviously not a safe thing for me. So my questions are, I appreciate that the new facility is going to be opening up at the Gander Mountain. That's in my district. It's going to be a large-scale facility based on what I saw on the slides. Since it's going to be large-scale and based on where it is there going to be any thoughts of transportation and logistics to get people there?
Part of the challenge, of course, with transportation is...
You need to speak in the mic or let Mr. Meisner answer.
Okay.
Thanks for the question, Supervisor Bodie. So that particular location is served by an existing OmniRide bus stop directly across the street. Our partners at OmniRide are also able to do some on-demand trip exceptions for folks that might need assistance, and we're continuing to explore additional avenues. I believe either Uber or Lyft nationwide has a promotion program to give folks a free ride to their vaccine, so we continue to look to expand those opportunities, but that did factor into site selection, was trying to make sure it was in an area that was accessible to public transit.
Sure, thank you. My very last question is something that was touched on earlier, where two more categories of folks were added to the I think it was the 1B category, the clergy and I want to say janitorial staff. In terms of Supervisor Vega's question earlier, where people are on the wait list, how does adding people factor into that? Because something tells me that if you were in one group and then more people got added to an existing category, people got shifted around, how does that work exactly?
If you notice, they were added to the, If you notice, they were added to the bottom of the list, so it wouldn't shift people around.
Okay. So if they had signed up and they were in one of those groups, or those two categories, and they were maybe in 1C or further down the list, they're now in 1B?
The bottom.
Okay, the
of
bottom
1B.
of 1B. Okay.
But, of course, if they had another reason to be registered, they may be higher up, health issue or what have you.
Sure. And actually, one final thing, sorry. In terms of the Johnson & Johnson getting into the mix, let's say someone got their first dose of Pfizer or Moderna, are we checking to make sure someone doesn't go and jump and get their Johnson & Johnson? Because obviously that wastes a shot essentially, right?
Yes, there's two ways. Number one, they receive a card as to what vaccine they received and the day they received it, so we can ensure when we give the second dose it's timed correctly. But additionally, as Brian had mentioned, we have a Virginia immunization registration system that you can look in to verify what dose somebody had, when they had it, et cetera.
Appreciate that. Thank you.
Go ahead. I can wait.
Supervisor Bailey, then Supervisor Lawson. It's 10 of 6. And then Supervisor Franklin.
Well, I'll pass it over to Supervisor Lawson.
No, you had your light on. Please go.
Okay. Two things. Number one, Brian, when you mentioned about the OmniRide, the bus system, I'm going to make a recommendation that, or maybe even a directive, however, that you look into, maybe we might want to look into for those senior citizens or disabled people that cannot ride the bus, that we look into transportation as it relates to this, like to the Gander, like if I had someone from my district, that might be a suggestion to get someone to the Gander facility to get their shot, because they may not be able to drive or they may not be able to ride the bus. So maybe if we could just rent a bus or get some kind of system where we can get the people to Gander, that might be an opportunity. Just thinking out of the box a little bit. And then the other thing is, I know in DC there's a senior buddy or vaccination buddy program that they've created for the senior citizens to have partners to understand what they need to do to prepare to have the disease or how do they get the disease. That might be something as a recommendation that we might want to do. And then lastly, on the weekly meetings that we have with Dr. Avola, he mentioned that they really want to engage the churches at a higher level, just going back to something that Dr. Ansher has said. And if we could schedule appointments with your committee, Brian, or your organization to understand what those churches should look like from that presentation that we have every Wednesday, so that we can be prepared to administer to the churches. I just wanted to offer that.
Supervisor Lawson?
Thank you. I just want to make sure that when we end this conversation, everybody is really clear on what our expectations are. And that would be a number of the doses that have been received and administered from the beginning. Not just the 2 weeks, but with the beginning of the rollout, correct? Because what I was going to say earlier is I know it was 3 or 4 weeks ago that Dr. Ansher, you were not here, but your communications director was here, and she couldn't even give us a ballpark. And so I think at that time, Supervisor Franklin, Supervisor Canlin were basically requesting a number, and a month later, we still don't have it. So to be very clear, that we want raw data from the beginning of the rollout. At least I would like that. And then Prince William Times article about the 3 inspectors that were hired to inspect businesses who had received complaints against them. It does state, and it's a quote from Patrick Jones in the health department, that contractors do have the authority to immediately suspend a business's occupancy permit. I appreciate that education is your first step, but to be clear, they do have that authority according to Patrick Jones. So I don't know if you want to weigh in on that or not, but I certainly would prefer to see people serving our community in the call center where they would be more effectively used. And I think that's all I have, other than I'm just anxious to get those numbers. Is that something that we can receive via email and not have to wait till next Tuesday? And then to Supervisor Bailey's point earlier, we really, I mean, I don't want to make it sound like we know everything about our districts, but we have a good, finger on the pulse of our districts. So Dr. Ansher, please utilize us. I haven't heard from anybody in the health department related to anything, like how I can partner with you and the community that we represent. So please utilize us to lighten your load.
I appreciate it.
Supervisor Franklin.
Sure, just very quickly, because I know we have to move on. Just want to clarify, I did issue a directive asking Mr. Martino to get the equity working group together. Just to clarify who those individuals are, they are part of Mr. Martino's leadership group internally within his group, so it's not an additional group or any ad hoc group, and so Mr. Martino will be working with his staff on that plan. Also, just want to make note of the town hall on Thursday. Just want to make sure that you all are taking notes of the questions that we're asking, because these are coming on behalf of our constituents. And we need to make sure that you all are prepared to answer those questions and really be proactive in bringing those topics up on Thursday. I don't know, what the format is. I know you all are asking residents to submit questions. I think today is the deadline, but I just hope that you're prepared to really address some of these issues, because some of them are concerns that we have. A lot of them are coming directly from our constituents who think that the Board of County Supervisors is solely responsible for the vaccine distribution. And I have to tell them, unfortunately, the reality is we play a very small role. I wish we played a bigger role. That's why I'm pushing for a health department. But I hope that you all are prepared to really answer these questions on Thursday. The last thing I will just say with regards to the transportation question, we do have a Wills to Wellness program that maybe we can look there for some resources, and we have a PRTC meeting on Thursday, so perhaps we can reconvene that part of the discussion.
And I will take us out on saying a couple of things as I've been sitting here listening. I want to thank the health department and county staff. I know that when we transferred information up to the state, they didn't immediately start using it at all. And we sort of pivoted back and went and started using our own list that we kept in-house, and we're filling the VDH slots. And so, I know that people have gotten texts recently. I've had people I know who got those from our old list that we were still holding on to because the state system wasn't quite working yet and still isn't quite working. And unfortunately, it's difficult to get people on that old list. And I know that they can do that. But so I appreciate what everyone's doing with that regard. I do want to say that the county doesn't control that, and I am frustrated. We do get calls saying, "Oh, you guys are just a big fail. You're not getting shots in arms." And I personally don't care how many doses we've gotten and to how many we got in arms. I don't want a gotcha moment saying, "Oh, we're not getting enough in arms." What I care about is how many people we're actually vaccinating, and can we do better? And I know it's very difficult, but what I would encourage you to do is to be flexible. If a large church on the east end calls you up and says, hey, I want to have a vaccination event, and we think we can handle it, to go there and have that vaccination event at that large church that might be offering that, okay? I would suggest that you use the people on the board, the North Star Network has 2 Baptist churches in it in Prince William County. One of them is in Haymarket, I think. So it's not reflective of our community. I think, I'll say 2 things. We have to do better, and I know everyone's trying, but we have to do better. We have to be flexible. We have to get in as many places as we can. At the same time, I think at some point, there's going to be so many doses available that we'll be begging people to get shots in arms, and that's going to be a whole nother issue as soon as everything ramps up from a federal level. And then we're going to have a whole new problem in trying to encourage people to get vaccinated, and make sure we get everywhere and have those small events just to get lots of people vaccinated. So, I know we're in a difficult situation, and I hear the frustration from my fellow board members, and we're just trying to save people's lives. So thank you for coming out today. I know if we can look for those numbers just in general about how many doses we might have gotten, where they all went. Apparently that seems to be important. I care more about how many doses we actually got in arms.
Certainly.
Thank you very much.
You're welcome.